thought a neat way to introduce this video would be to time-lapse my root canal. And I've already got my equipment, and I've got to get my hair cut first, so I just wonder, Alright, time to head to the dentist office. Have you ever wanted to be a dentist or a doctor? It takes a lot of science and math. And so I visited with Dr. Dallner today about filming this procedure and visiting with you guys a little bit about his occupation and a little bit about what it takes to become a dentist.
Why would we choose to have a root canal over, say, a filling or maybe even extraction?
Sure. There's different points in dentistry where we do different procedures, and so basically when you get to the point of doing a root canal, it means that the nerve in the tooth has been affected, and that can be for a couple of different reasons. It can be either a cavity that's been in the tooth has made it to the nerve. Basically, a cavity is started by bacteria. Those bacteria soften the tooth, and they get to a point where they get close to the nerve where it's damaged. The other part of that would be maybe a cracked tooth, where a tooth has been broken or it's been traumatized for different reasons or different ways, and that's also affected the nerve. So in both of those situations, in a situation of a cavity that's reached the nerve or a crack that's reached the nerve, if you just fill or put a crown or a cap over those teeth, they will continue to hurt because the nerve has living tissue inside of it. It has blood vessels, it has nerves inside of it, and so they can't survive without being taken care of. Basically, the process there, if you just fill the tooth will keep on hurting there. The reason we try to save teeth and the reason we try to save them in their space where they're at is we want to, one, keep from changing a patient's bite, keep from affecting the way the other teeth around it are aligned. Sometimes there's shifting that can occur. Help maintain chewing so that you can chew and masticate food, take care of that. And other things that we're seeing now is that as we lose posterior teeth at the very back, it can also start to affect our jaw and the function of our jaws, aches and pains in the joints by losing some of those teeth.
Doctor, if you wouldn't mind, just kind of give me a heads up on and where you started your ideas about going to college, maybe getting a career in medicine, and kind of what that took for you.
Yeah. I was always kind of interested in the science part of what I do in the profession, but I knew there were a lot of different options out there, different things that I had considered going into, medicine being one of those things, and going to vet school. One of the biggest things is I had a childhood accident where I had actually had some trauma. I had to have a root canal early on when I was actually 8 or 9, so I kind of sympathized with those situations as well, and so I was very interested in that. I knew that dentistry was something at that time that you could work with people, like to communicate. You still get to use that science background that I was very interested in, and then also there was the other aspect of kind of the artistic side of it. Get to recreate, build things. I like to work with my hands quite a bit, and so there were so many different parts of that really interested me. The science being the biggest part of that, and so I had that interest and actually started shadowing some dentists early on to see if that was something I liked. I also kind of shadowed in medicine and going into vet school and those type of things.
Kids are always curious about what does it take to get into a profession like medicine, and what are they looking at as far as grades. So really my question to you would be, were you adamant about making good grades in middle school, high school? Was that something that you cared about, and kind of how did that fall into your college readiness?
Sure. I think that grades are very important in the picture of going into colleges. I think colleges are looking at that now very, very importantly. But I think the other part of that is the well-roundedness and being involved in many things. I think that communication is huge, especially with what I do. I deal with patients every day, and so and I think both of those really play into that, because not only do you have to have the educational part of that, and you want to strive for good grades, and they look at that, but they also look at some of the other things that you do as well. I always thought that was interesting. I served on one of the committees where we looked at students that were coming in to the dental school, and just as a student, I interviewed a lot of those students, and I think that communication helps. I think it helps dealing with patients, and I think it helps you in anything you do in life. And so I think that's important. And I think starting on early on, preparing and just kind of getting used to the study habits. I know a lot of students, they can look at things. I wasn't one of those students that could just remember something off the top of my head and go take a test. And I think that helped prepare me, just learning how to study and learning how to look at materials and really learn it rather than just repeating it for a test, because it's something that what I do every day, we have to recall pretty quickly and have to remember. So
I like the way you touched on that. I'm consistently telling my students that don't just remember something for tomorrow's test,
Right.
but remember it for a lifetime. And even if you don't use it all the time, at least remember the main concepts
Sure.
behind things. And so I know with medical school and all those things, there's lots of science, lots of math. So was that one of your strong points when you were in high school, was science and math?
I did. I liked those classes. I really focused on those and tried to take a lot of those classes early on. Just kind of what we were talking about, I wish in looking at that I would have realized I was really going to have to take a lot of those classes over again when I went to college, and then even when I went into dental school, we retook some of those same courses again. So chemistry, microbiology, different things that I had at the college level and even in high school. You retake a lot of those courses, so taking care of that the first time and really learning that information the first time makes it a lot easier the second and even the third time around. It just kind of emphasizes the importance of what they want you to know and your thinking process. A lot of the sciences, it's the deductive reasoning, thinking out things, and that's what I use every day, because not one procedure that I use is the exact same every time for every single tooth, because we're all different. So being able to think through those processes and really use your base knowledge helps out. So.
I want to thank Dr. Dallern and his staff at the Emerald Dental Group. They were really great folks to work with today, and the fact they allowed me to film and take some questions was just great. And I want you to kind of key in on some of the main points that he focused on. Whether you're going into a health science career field, or you're going into something totally different, engineering, whatever it might be, maybe it's even teaching. Being able to expose yourself to many different aspects of life are very critical to find out what it is that you want to do. And it's also great to be able to relate to more people because you've had experience in many different things. So you notice that Dr. Dallern enjoyed being an FFA and doing some of the things that I know some of my students are involved in. And so some of those things just cross-connect in so many avenues of life. So I'd encourage you to get involved, not just in school, but outside of school. Get involved in your church, get involved in a nonprofit organization, maybe get into Boy Scouts, Girl Scouts, something that's going to get you connected with learning some leadership skills and being able to communicate with people. And you'll never know where those types of avenues can take you in life. So I hope you enjoyed this. I hope this isn't just the first of videos that I look at different occupations related to science. I hope there'll be many more to follow. So I hope you enjoyed this. Feel free to leave me a comment. I would love to hear from you. Give me a thumbs up of this video if you enjoyed it. And the time-lapse stuff, I always enjoy doing that. We'll talk to you next time.